case of sickness, is anyone allowed?
We do allow people to access when they have very serious sickness. Those are the certain things that only if you leave the country permanently. So we have some levels which we allow people to access. So but then there's a level, if you're very sick and the doctors prove that there's a problem and then they think that that can help you, that's fine.
Then help us understand how the recent adoption of the proposal to have individuals use part of their retirement savings to pay for mortgage. How does it work?
Those regulation mortgage came into effect, and one or two financial institutions have taken it up, whereby they'll be offering as part of the loan that portion which relates to the deposit, legal fees, and other handling costs. Instead of you going to another institution to get it as a loan, while the house itself is the first security, so that the house is like 80% of the value, and is securing the original loan. So the 20% will now be covered by your pension. That should help you get the house without paying anything. Otherwise, you'll get about 115% loan.
And then there was this proposal to have house helps brought into NSSF. How is that coming along?
Yeah, that was done in October. It became effective last October, and means that people are supposed now to contribute for their house help. I think what NSSF now need to do is I think they've also been sending out demand letters in quite a number of households. I saw some households in Rwanda and the other places there have been given letters, find out if they have employees who are not registered. And I think slowly, if they can put more resources towards that, they can get most people to register their house helps, who people work for them for purpose of contribution to their NSF. And even that, if the amount should really be very low, they don't have to make it very high so that people can contribute. Even like the way we are doing with the pensions, your carry scheme, 20 shillings or 30 shillings. Because that minimum of 200 might be very high for most employers.
The proposal has actually been criticized for being very hard to implement at a household level, while most employers really would like to have their employees, or their households for that matter, contributing to NSSF. But the logistics they're very difficult. What are the ways, or what would you propose? Easier ways that employers don't find it difficult?
One thing that I would like to urge employers, if we can use our registration method, because if you have your ID today, you should be able to go anywhere. You can be found, at least you have documentation. And if you talk of house help, the way house help leave one place to another employer, and if they were contributing to them, so then you go to another place, it's very easy to know where that person went to. You see, because anytime you go to a new employer, then the new employer will be contributing to you using your ID, and he can get your details and your background, even if there was a problem in your house before.
And then you actually mentioned it, a proposal to have a universal pension plan. What's that about?
Definitely, when it comes to elevating old age poverty, that is the only way forward, whereby we have a universal pension plan targeting anybody who are vulnerable, so members of society. Already the government is doing a pilot for people above the age of 65, so that those people above the age of 65 are currently being paid about 1,500. And this was targeting a few districts before, but I'm seeing that being rolled to all counties once the counties, like now the counties are on and the program is in place. But you imagine that somebody who is above the age of 65 being paid 1,500 shillings a month, that already will change the structure within that area. It will create investment within that area. And that alone will have a multiplier effect. And we will not have people dying of hunger. So if we can have that basic safety net, it will help, although it's tax-based. In other words, the people working definitely will have to chip in. But definitely you know that when you retire, your parents will not even ask you about it because they'll be having some form of income. We're also looking towards incorporating health within the pension, such that as you work and when you're contributing to a pension, you also contribute certain amount which goes to your health. Because when you retire is when your health is affected. When you're working, it's taken care by the employer. But if this is incorporated, some health insurance within the pensions, that means that when you retire, you're still taken care of health-wise.
Thank you very much.
Thank you very much.
Thanks. Well, that was the Chief Executive of the Retirement Benefits Authority urging us to save. And it is said, money saved is money well spent.